not happy.
It's just
Obviously 80%. I'm really anxious now.
So there's no CO2 trace on that monitor. Was there earlier?
Yes, I believe there was. I mean, it's 1.5, but it's flat.
Fine, that's not ideal. Okay. I've changed trachea went in a few days ago.
On the 28th, so it's 7 days old.
Yeah.
Size 7 per trachea.
Okay, we're getting a bare minimum of air to bare. Have we got?
On direct. That's thank you.
Can you just do me a favour? Can you just keep an eye on updating for me?
That's it. Lou, have you got the emergency
John, I'd like a little bit of
tracheostomy bundle? Have you got the emergency tracheostomy flowchart for us?
Have we got what?
Indeed.
For a second. So I'm concerned that there's an issue with the trachea potentially. We're not really getting any out. We've not got any CO2 trace. I'm going to disconnect from the vent. Lou, if you could make the vent not beep at me, that would be amazing. And if you could pass me that back filter that I've taken out.
So
We have got the algorithm on the reverse.
yeah. So I've got it if you need it, Jane.
Yeah.
Sorry, so just some background. I have. Is the patient sedated? And are they being
He's been on ASB the past couple of days.
Okay. So has he got any drugs running at the moment?
No.
No.
He's being fully with it. He's just a little bit anxious.
Okay. We're not getting any CO2, not really a CO2 trace that, so I'm very concerned the trachea's in the wrong place. If in doubt we are going to take it out, we'll need something to occlude the trachea with, and then we'll need to put something from the top.
It's
Yeah.
a big leak on him.
Let me know if you want me to read down the checklist, Jane.
I can
yes, please.
see that this is, to me, looks like a fenestrated inner as well, guys.
Shannon, can you do me a favour? Can you just keep an eye on my patient, please? Yeah, thank you.
So are you able to remove the inner? And pass the suction catheter down the outer so we've got a patent tube.
I'll go and get you a suction
Thanks. You have a French suction.
Do you want to use the suction for them while I bring this in?
I've just got the Yanker. Have you got like a...
Yes. No, we need a softer one. I genuinely can't unscrew that.
Okay. Super. So the algorithm says, is the patient breathing?
No.
Okay. Have they got a central pulse? We'll assume yes for the purposes of this.
Yeah.
Okay. So tracheostomy patience is next. So
It's a
you
bit stiff, this one.
remove the speaking valve or cap. Remove the inner tube. That's the next step.
It's really structural secretions, isn't it?
So you do need to take out the inner lumen if you can.
Can I help because you can't suction down it fenestrated, so you've
The
got
setting
to
was like
twist.
having really thick secretions,
Oh my
didn't it?
God. Really
I
stuck
genuinely
now,
can't
Jade.
get that out.
Yeah,
Right. So
Okay. Try and pass the suction catheter.
that's really problematic. I think it's stuck with the secretions.
Right, in which case we're just going to take the whole trachea out. If we can't get anything down it and we can't move the inner, then that is...
Okay. You can always just deflate the cuff and air can pass from it top to bottom.
I'll get you a syringe.
Oh, is it already down?
Jade, I'm
Okay.
behind you with the syringe.
That's
The
fine.
cuff's already deflated.
That's a 74 there.
Yeah. Fine, so I'll have one more attempt at passing that catheter down, but it didn't go down before.
75%.
Yeah. No, that won't go down at all. 3 of us have tried to get the inner out and it won't come out.
Okay. So it's
We're
included
assuming
trachea.
that's blocked. The cuff is already down and we're not getting anything through, so that is coming out.
you
Have
like
we
me
got
to
some
set
gauze
this?
to occlude the airway, occlude the hole with? I will. We will down from the top end. Right, put this on a roll.
I've just got the angle.
Would you be able to press that on the front, Joe, while I'm...
I'll do that for you.
I'll do, yeah, lovely.
That's it. Would you like some drugs drawn up, Jane?
Yes, please. We're going to have to re-intubate from the top end.
Please may I have some drugs drawn up?
I will bag with this
okay?
initially and then we'll connect to
Thank you. In
oxygen
fact,
by the
I can do
ventilator.
my own. I will have some of that.
Right.
Got some
That
before.
looks like I'm doing
Some of
chest movement. And I do have
Some
an
Mesraminol and some Restor.
Lou, you're doing a fabulous job of including and setting everything else up. I am still on air at the moment, so if we could get a water circuit connected to oxygen, that would be lovely. But we know we can ventilate. I can still see a CO2.
What's some drops today?
And that's arcing up because he is ventilating now, even if it is on.
Jade, are you happy we've got enough help, or shall I give some more
Yeah,
folks
should
a
we call
shout?
the consult? I don't know which consultant's on call,
definitely.
whoever
I'll
that
give them
is.
a
Let's
buzz.
have them,
Sat 32%.
which is better than
Heart rate
74.
141. 6.1 in
Hello, could you put me through to the
bagging.
ITU consultant on call, please?
Did we get
Hello,
some
could you put me through to the ITU consultant on call, please?
Yes, we'll do. Hold on.
Thank you.
Hi, it's Niraj. How you doing?
Hi, no, it's just Joe on intensive care. I'm afraid Mr. Beam in bed 6 has got an occluded tracheostomy, which we've removed and are ventilating from the top end. Would you mind attending the unit immediately so we can re-intubate him, please?
Yes, okay. I'm on my way.
Thanks, Niraj. Bye-bye. Niraj is on his way, Jade.
We've got drugs thrown at you.
Correct, yeah. I've got
We
propofol
have
and rocuronium for induction. I've got rescue metronidazole and rescue adrenaline. Is there anything else that you'd like?
Fabulous. I know he's very tachycardic at the moment, but something to heart rate as well, glycoratropine, whatever's there.
Yeah, absolutely. I will get some.
Just in case he has a very difficult intubation, we know we can contrast it with some Anaesthetics as well in case it's absolutely
Reversal. We haven't got a
Are we any
label.
closer to getting oxygen? Lovely.
That's it. What would you like?
So if we take off the T piece and put an angle piece on instead,
That's it.
Thank you.
then is that connected to 100% oxygen on
It
the...
is.
That's it. That's still only 82.
Yeah, can you do this one?
Like a good Jade,
That's not the right...
he remains hypoxic.
No, I want oxygen. I'm ventilating on air at the moment. They're trying to set off the blood circuit to connect to oxygen. That is what I want. We've got a good CO2 trace and chest
This bit
movement.
doesn't get used.
I just need oxygen to go.
I'll
Could
leave
you
that
help
to
them set that up, please? I don't have the spare.
Can I have that bit?
Yeah, brilliant.
Where's my bread pot? Have you taken the twisty
pot.
bit off?
Yeah.
Where's the
Got it.
You've got
Thank you.
lovely.
That's it. That's it. That's it.
Right, we are going to lose CO2 for a second because there's not going to be the filter in there. Right,
Can we just put the filter back in?
Lovely, thank you.
No problem.
Right, we will ventilate up on the oxygen now. Is the...
It's turning up now.
Will that actually... Oh yeah, it isn't
Jade,
breaking.
are you
Fabulous.
easy to bag? Are you happy?
There you go.
Let me know what's happening off.
Well, if you turn down to 15 litres, otherwise it'll just overinflate. That's lovely. I'm just going to turn that around because I'm better that handle.
Your sats at 88. CO2 6.1, Jade.
Fabulous. So we are now pre-oxygenating. Jim, I kind of forgot that you were meant to be conscious. If you can hear me, we're taking good care of you. I'm keeping pressure on that trachea seal. We're ventilating.
Sorry.
Sats are coming up nicely. Jim, we're going to need to get you to sleep to pop a new tube down to help with your breathing.
What's your plan, Joe?
Exactly what we're
It's
doing.
Jade's plan. I'm just waiting to set. I've just set up everything. Jade, I've set CMAC up as
Do you
first
want
look.
the necklace getting out if we're going to pop this gentleman off to sleep?
You've got a cuff competent size 7.5 tube, rescue 4, just because that's what's available. Obviously, it's an 8 and a 5. CMAC as first view. You happy to be first intubator?
Yeah, have you checked the tube, please?
The cuff is competent, yeah.
Yeah, tube.
Jade,
Have you lubed as well?
Are you happy with me
I
to
don't
start
know when
going
we can lube
through
these
the
mannequins.
checklist?
It is lubed.
Yes, please. So if we just have quite well lubed.
Does the patient have a reliable IV and IO access? We've got 2 cannulas this side. Joe, are you happy with these
Happy with that.
cannulas?
Okay, so we're desaturating again now. How are you doing there, Jim? Was he conscious to begin with?
He was, yeah, he's just.
Okay. Is he still conscious or
Yeah, he's alright. You're right there, fella.
can't put an eye job? Good down there. That's right. Sats are starting to come up again. Sats are very variable. Right, let's get crack on with the checklist because we need to get a tube down.
Have we got him in an optimised position? Are you happy with that pillow in there, Jade?
Yeah, that's fine. Ooh,
Airway
got a
assessment.
link there. So he's been intubated twice because he was intubated,
Yes.
failed extubation, re-intubation, so there's potential for airway edema. He's had a trachea, potential
week.
to have bleeding in there as well. We are going to need to put a more dressing that doesn't involve someone's hand on the front of that eventually, but we're good at the moment. He is potential for a difficult airway. Have we got a stilette for the CMAC?
I will make sure.
Negative, we've got a bougie.
Okay. I very much prefer stilette.
We've got a.
We can notionally say you've got a Stella if you like.
I've got a Mac 4.
I've actually got a bougie.
Do you want to continue with your?
So plan A will be a CMAC with a bougie. Definitely need a bougie. I can't get a tube in without. So we've got IV access. Has someone tried to flush that, or is there still fluid running through it? There's still fluid. No, that's working. I don't identify quite as I remember, and it's slightly more challenging given that there's been a hole in it, but I'm really sorry for getting your name. Shannon's already got things on there. Awake intubation an option. Not really. We're pre-oxygenating, and so that's our kind of coming up. NIV CPAP's not enough, and we need a secure airway in nasal. fluid pressure sign check. We've got fluid running.
Fluid
You've
running.
got
Fluids.
adrenaline, methylaminol, and glyco or atropine. of some
Atropine
description.
and secamidec to reversal virus high-dose if you need it.
He's not got an NG in, so we can't aspirate it. Is Jim known to be allergic to anything?
No, not one I'm aware of.
No.
Fabulous. Do we have a recent gas? What's his potassium?
I don't actually think there's been a recent gas done this morning, sorry.
Did we have bloods this morning?
And that last time you used potassium was like 3.9.
Fine, so it's not hyperkalemic, certainly. We have SATs.
Oh, his outline's been taken out, Jade, sorry.
Oh, that's fine. We've got SATs, we've got a waveform and tidal, we've got an ECG. How frequently is that blood pressure cycling?
I'll do it now.
And if we could set it to go off every 2.5 minutes while we're cracking on, that'd be
Yeah, well
lovely. We've got a tracheo tube which has been checked.
Correct. Size up, size down.
Fabulous. We've got direct laryngoscopes I saw in the drawer. We've got a CMAC there. Does it have a D blade?
It does on the top of the trunk.
Lovely.
Yes, indeed.
So we can put the D blade on the CMAC, so that's what we're going to use, and we have a bougie ready as well.
I don't know if this one actually takes it, so again, we're going to just use the
Okay.
equipment we've got. I don't know whether this takes it or not. Sorry.
No, it doesn't.
No, that's fine. Do we have suction?
It's under your
We have
left elbow.
suction, yeah.
It's under your left elbow.
It's ready under your pillow.
Thank you very much. We've got supraglottic airways. We've got a size 4 gel out there, which would be my preference for his size. We have Goodell's in there.
We do.
He's
in-
conscious at the moment, so can't use one, but
Yes.
once he's off to sleep, we may need
Blood
one.
pressure's 144 or 75.
That's fine. And that's set to cycle every couple
Yeah.
of minutes. Lovely.
Make sure it is.
We've got Goodell's if we need them. I would guess he would be a yellowy orange one, but we will check at the time. Have we got fibre optic skull pain treat plastic if we need it?
I don't.
Yeah.
I can shout some for the bronch. It's next door, the bronch. Yeah, I can set some away to get it.
And front of neck kit if needed.
We have a size 6 with a 10 blade rounded side present and correct there.
Fabulous. Consider drugs. We've got induction drugs, we've got relaxants, we've got pressors, and maintenance sedation. Is someone getting that ready?
Yeah, I believe we can get some drawn up so we can get some propofol now.
Lovely. Right, allocate roles. Joe, because I'm at the head end, do you want to be team leader so it's a separate person?
Yep.
I'll be first intubator, you're second, but
If Niraj arrives in the
Niraj.
meantime, he can take over a second.
Fabulous. Shannon's doing cricoid. Lou, are you happy to be intubator assistant?
I am indeed, yes.
Lovely. Joe, as well as leading, you're happy to do drugs?
Correct.
Wonderful.
Do that.
We'll all really be monitoring the patient, but
I'll
John,
let you know if anything changes.
we call John, so yeah, John will keep a close eye on it. And John, are you happy to be our runner as well if we need
Do you what, sorry?
runner if we need?
Yeah, absolutely.
Thank you. We don't need manual and line stabilisation. Front of neck. At the moment, Joe, you'd be in the best position to do it, but if we swapped and you're attempting to intubate and I'm not, then I would. So whoever's not at the head end, essentially. We call Niraj for help. We've already called him and he is on his way
He's on his
in.
way.
I am facing the clock, so I will know at the time that drugs are given. Can we wake the patient if intubation fails? Yes, but not with a secure airway, so not ideal. Plan A is Curacell's per Joe, CMAC with a D blade and a bougie ready to go, and a 7.5 tube for the size by the looks of it.
And Jay, just for everyone in the room's awareness, his previous intubation via a CMAC using a 4 blade was a 2B.
I don't have a size 7.5 tube